Do you often notice that small cuts take forever to heal, or your gums keep bleeding even after brushing gently? Imagine your body's defense team failing to reach the crime scene. That's what happens in leukocyte adhesion deficiency, LAD. Normally, when germs attack, your white blood cells, the body's soldiers, rush to the spot to fight infection. But in LAD, these soldiers can't stick to the walls of blood vessels or move to the infection site. So, even a simple bug can cause big trouble. It's like calling firefighters, but their trucks can't leave the station. The help is there, but it can't reach the fire. What causes this breakdown in communication? It's mostly due to faulty genes passed from parents. Think of it like a broken lock and key system. White blood cells have keys called adhesion molecules, like LF, a one on their surface. These keys help them grab onto blood vessel walls and crawl out to infected areas. In LAD, the body either makes faulty keys or no keys at all because of genetic mistakes. It's often due to a mutation in genes, like ITGB2. So, even though the white blood cells are made, they float around uselessly, like delivery drivers who can't get out of their vans to hand you your package. What would you feel if your body couldn't fight infections properly? Babies with LAD often show signs within days after birth. Imagine a newborn whose belly button keeps oozing and doesn't fall off even after weeks. That's a classic sign. They also get frequent skin infections, gum disease, and slow healing wounds without pus. Yes, pus is actually a sign of good immune response. Its absence is worrying. They might have high fever without clear cause, and their white blood cell count is unusually high in blood tests, but infections persist. It's like your phone shows full signal, but you can't make calls, everything looks fine, but nothing works. How do doctors find out what's wrong? They start with blood tests. If a baby has very high white blood cell counts and repeated infections, doctors may suspect LAD. A test called flow cytometry checks if white blood cells have the proper adhesion molecules, like scanning ID cards to see if soldiers have valid access cards. Genetic testing confirms the faulty gene. Once diagnosed, treatment includes antibiotics to control infections, and in severe cases, a stem cell transplant, meaning replacing the entire faulty immune system with a healthy donor's. It's like rewiring a broken security system with a working one from another house. Without transplant, severe LAD can be life-threatening. Can we stop LAD before it starts? Since it's a genetic condition, there's no way to prevent it after birth. But families with a history can seek genetic counseling. Think of it as a family health map session before having kids. Doctors can test parents for carrier status and even check unborn babies via prenatal tests like amniocentesis. It's like checking your car's engine before a long trip. Catching issues early can save lives. For diagnosed babies, avoiding infections by staying away from crowds and keeping hygiene strict is key. Early diagnosis and planning are the real prevention tools. Scientists are exploring gene therapy, fixing the broken gene inside the patient's own cells. Imagine editing a typo in a recipe book, so your body starts making the right adhesion molecules. Early trials show promise. Some kids treated with gene therapy have developed functional immune cells without needing a donor. Also, better matching for stem cell transplants and newborn screening programs are being tested. One hospital even spotted LAD in a baby through routine blood test patterns before symptoms worsened, like predicting a storm before the clouds gather. These advances bring hope for a healthier life without lifelong infections.